Hi, everybody, and good afternoon. I'm News 13's Amy Hoyt. We are live in our newsroom in downtown Panama City. And today, as you know, is the 13th of the month, and that means it is Buddy Check Day. We offer a reminder for ladies to check for lumps in their breasts. And of course, if you feel anything or you notice any kind of change, for you to go to your doctor immediately and set an appointment and maybe, of course, get a mammogram. On these days, we also like to bring you a guest who can share their story, someone who has lived through the diagnosis and knows exactly what it feels like to have breast cancer and to survive it. And our special guest today is Deana Williams. She is a breast cancer survivor, a Bay County resident. Good to see you.
Nice to be here. Thank you.
Tell us a little bit about yourself first. I know you have a medical background.
Yeah, I'm a family and emergency medicine nurse practitioner. Currently not practicing, but I really miss it.
And your husband was in the Air Force. Is that how you ended up in Bay County?
Pretty much. One of us needed a real job. He was retiring, and I took over the Navy clinic at the time, and that got us here, and we like it very much. We've been here for 12 years now.
All right, very good. Well, we're glad to have you. Tell me a little bit about your diagnosis. You told me earlier it was 11 years ago.
Yes, it was. It was in actually my grandmother's birthday, September 19th, is when I had my mammogram ultrasound, and then the next day I had biopsies at Bay Radiology Women's Imaging.
All right. You found the lump yourself first?
I did. It started when I was 40, and I had my first mammogram, and I pointed it out, and so they ultrasounded it. So I was on a 6-month mammogram ultrasound kind of a routine until I was almost 3 months out to my 6-month appointment, and I felt then my lump getting bigger, and not only getting bigger, but now there was another one. And so I had a little bit of weight loss, and so I called to make an appointment to have a mammogram ultrasound right away, and then they sent me to Bay through Dr. Wong to have a biopsy.
So this happened when you were 40?
It started when I was 40. I felt the lump. I was diagnosed with breast cancer at 44, and now I'm 55.
Oh, wow. Okay. So, I mean, that's still pretty young
Yeah.
because that's when they recommend
Right.
Ladies get their first mammogram.
For sure.
Is at 40.
Yes.
Was there any family history?
Nope.
No.
Not even a funny looking mole. And nobody's ever had cancer in any generations that we can go back to.
Did you know? Like, did you have a feeling?
Oh, when I went in at the halfway point before the 6 months, absolutely I knew. I absolutely knew.
All right. So where do you go from here? You get the diagnosis, and then what?
And then you start thinking about what surgeons you want and what are your options. And I was very lucky to have known a lot of people in the town from working here. And so I went to Dr. Wong for my general surgery and Dr. Nunnery for the reconstruction. And they kind of tag teamed it. I chose bilateral mastectomies. And then I visited with an oncologist who was brand new at the time. It's Dr. Weber. And since that time, he's still here, and so am I.
And we're happy to hear that. And so all your treatment was in Bay County. You stayed here for
I
all
stayed
of that.
here. This is a wonderful place to have so many things done, and I trust everybody that I see as a medical professional. We have first-rate stuff here, too.
Right.
You don't have to go to Texas or Jacksonville, you know.
So as a nurse practitioner, how are you processing this? Was it different than if you had no medical background?
No, I don't think it is. I think you process it in the same way. I was shocked, but as I went for that mammogram ultrasound, I knew just looking at the ultrasound when they were doing it that it was not just a regular, innocent lump, because it was in the duct, and then it became invasive. So the take-home message is that if you're not doing your breast checks at home, you're the one who's with your breasts every single day. Your doctor sees you maybe once a year. So it's very important, because I noticed a change almost overnight. And when we're talking about cancer, we're talking about rapidly dividing cells. So they don't really care what it is, but they're going to rapidly divide. And if you're going to give them a blood supply, they're going to take it, every ounce of it. So I felt it rapidly divide, and it changed from a little pea size to more than 2 centimeters very quickly.
Now, when you were diagnosed, when you were with the doctor, were you by yourself? Was your husband with you?
My husband was with me.
He was with you.
Mm-hmm,
How does he
100%.
react?
He just said, well, we just have to keep a positive attitude. Let's see. And he was, the whole time said he was lying to himself and telling me those things.
Course.
And he came to every chemo. He came to every appointment, every surgery, multiple surgeries. But
Being an Air Force pilot, he's probably very pragmatic. Just get it done.
yeah, well, and I was too. I chose to have a bilateral mastectomy, even though it was only on my right side and my right lymph nodes, because knowing what cancer can do. It can't do a lot of things, but it can come back. And so I thought, well, if it comes back and I'm 65, would I actually get that surgery? Would I be able to withstand all of this same stuff? And my answer was no, I probably won't. So I'm just going to take everything out now. And then I just have to monitor the other things.
How was the surgery? What was that process like?
It was pretty simple. I mean, straightforward. So like I said, I had Dr. Wong and Dr. Nunnery tag teaming. I had, after the mastectomy, I had spacers put in to see if I was going to have reconstruction at a later date. The recovery was about 2 weeks. It was very sore to lift up your arms. And then meeting with the oncologist, getting a port put in for chemotherapy, and we decided on a chemotherapy regimen that was, a basic for my estrogen receptor positive breast cancer. And so
The chemo.
it was horrible. It was horrible. We bought a wig before I lost my hair. Because that's what they say you should do. And then I did not like the wig at all. So at the time I was working at the Navy clinic, and I would just wear a hat because I was freezing. And all the patients and families all kept bringing me hats. And so I have a collection of silly hats to wear. So that was what I did.
Did you have what they call the red devil?
No, I did not have to have that. That's a Herceptin receptor positive, and I was not HDR.
What about
or
radiation?
No, I didn't, because I talked to Dr. Murchette at the time. He was with Bay, and he says, you're on the edge. You had lymph node involvement. You had 2 that were 2 centimeters. We could, or you can save it for another time, because you can never re-radiate an area that you radiated. So that's what I chose. I chose not to radiate at that time, but took medications for 10 years. I just got off of it.
Wow. Because 5 years, isn't it, for women? They say you're clear.
Somewhat, but 10 years is the more to suppress any estrogen that my body might still have. And I had a hysterectomy. I had my ovaries removed. I took away everything.
What was the reason for that?
Because tamoxifen was the first choice of drugs, and I couldn't handle it. And so there are other choices that we actually went to, which worked, but it was a reason that I could have a hysterectomy. I was having awful periods. I had really bad anemia, so I had a hysterectomy, and haven't looked back since.
How old were your children at the time of the diagnosis?
So my oldest had just started college. My middle kid, she was in 10th grade, and she shaved her head.
Oh, it's for you?
Yeah.
Oh, that's
10th grade girl. I mean, how hard is that? And then my youngest was in middle school in 8th grade.
Wow. So how did they deal with it?
I don't think it fazed them. They all made sure I was, kept company if I was throwing up. And even though nobody in my family likes throw up, they all were there. They all hate it. They all get squeamish. But so I tell people we do Making Strides, and it's all about pink and glitter. And let me tell you what, we don't throw up pink and glitter for sure. But that day is a very good day to celebrate what we've gone through and what we're doing. The hope that we have to get rid of this.
Now, do you worry about your daughters?
100%.
And now,
absolutely.
Where does that leave them now that there is a family history?
So I did not have the gene, which is good. And 80% of people who have breast cancer don't have a family history. So
has that changed over the years?
No, not really. Not really. 80% of people do not have a family history, and 1 in 8 people will get breast cancer.
Yeah,
I am 1 in 8.
It just seems like more and more we hear about women getting breast cancer, and there's no
yes,
family
and
history.
younger, very much younger
Is
too.
that just our imagination?
No, I think that it's just bringing attention to this awful problem we have, and it's any cancer. We really need to find a way, however, to kind of tame it. But you do everything. Like, I knew that preventing breast cancer meant having multiple pregnancies, breastfeeding, doing all the right things. And you can do all the right things and still get breast cancer.
Right.
So you can have your mammograms, you can check your breasts, you can be diligent, but that you really have to be diligent because it's you who's going to save your life. You're going to know something is different before anybody else.
Right. Now you're pretty active
I am.
with getting the word out there, breast
Oh,
cancer
for
awareness.
sure.
What kind
Yes.
of things have you done since then?
Every year I do Making Strides, and I have about $1,000 to $2,000 raised, and it's all from actually my Facebook friends who I went to college with, I went to high school with, and military families that have known me over the years. And so I just put it out there, and they just keep giving because they know that we need to take care of this and somehow find a way. And plus, the American Cancer Society does stuff with that money. They do free rides to chemo if you don't have a ride. They do wigs. They do, how to do your makeup and things like that. So it's a good support for people.
And of course, that's always in October for Breast Cancer Awareness Month, right?
Yes.
All right. That's why we wear pink a little bit more often,
Right.
other than just on the 13th of the month.
Right.
Well, what do you do now? I mean, where do you go from here? You said you're taking a break from
I
work.
am, and it's been a good break. Just trying to focus on my health. Lost a lot of weight, and
Do you feel okay? You look okay. I mean, you look like you're okay. You
Well-
look good to me, but I didn't know you before today.
on certain days I feel fantastic, and on other days I don't.
You think that's
so-
still a part of why?
I don't know. I have I get fevers a lot. I get sick a lot, and being away from the hospital has really helped that. So I don't get sick as near as much. And
Were you worried about COVID when it hit?
I was, and I got it in Germany in November of
Oh.
2020, and I still can't smell.
Wow.
Yeah.
Yeah, it's a personal question. Did you
Right.
get the vaccine?
I did when it
You
came
did?
out on January 1st.
You did right away.
Then I got my second one, and then I got actually a third full dose because if you're immunocompromised in any way, they
Right.
suggest you get a third full dose, and then I've had 2 boosters.
Okay.
So I feel good. I think my immune system's working. I
Right.
finally took off my mask. I mean, it's been like 2 weeks ever since I got that newest dose of all of them combined. I took off my mask, and I have to
Yeah.
remind myself I have immunity. I have immunity.
Right. Yeah.
I
I'm
just
sure
got to watch it.
it plays on your psyche a little bit. It has
For sure, for sure. I explain to people cancer is like, you could be gone one day and come back 20 years later or 30 years later or 10 years later. I describe it to people as it feels like there's a sniper somewhere. I don't know where it is, and I don't know when it's going to come, but I'm fearful that it might. And so that's one thing I've been working on with myself is not to worry about tomorrow, just take care of today. But it's easier said than done, actually.
Yeah. Yes, I can only imagine.
Yeah.
But you don't like? Do you feel like it'll come back at all, or
I think
is that what you're saying?
I think
You
I've
do
made
worry
it.
about it.
I do worry about it,
Because, I
but
mean, 10 years is a long time. 11.
yeah, it was in my lymph nodes, so anything is possible.
Explain to us, since you do have a medical background and you're a breast cancer survivor, what does it mean when it gets into the lymph nodes?
That means it's in another area where lymph is fluid that is secondary to your movement of blood in arteries and veins, and then the lymph system. The lymph helps clean out things like that cause infection, and they are really under your arm, down your sternum, in strategic locations that.
And you had some of those removed?
Yeah,
Yeah,
I did.
they have to take them out.
Yeah.
What does that do to your health? Like, does that change your body?
It does. Oh, yeah.
Yeah.
For sure. Oh, I had reconstruction, and then the reconstruction had a problem. So I chose for no implants and no reconstruction, and I haven't looked back. So I'm happy.
Can you share with us what happened after the first implants?
Well, I had dividers and spacers and all those kinds of things. And then they had these special breast implants that were, special for breast cancer. And I had them in, and then my skin started to eat away at this implant. So I had them removed because it turns out some of the implants can cause cancer. And so it was something that I said, I'm not going to even risk it. It's not
So you had to
worth
go
it.
through surgery again to take those out.
I had like 7 surgeries
Wow.
altogether. Yeah.
Oh my.
Yeah, I had a little bit of problems with everything, but I haven't had a surgery since the implants came out in 2017. So,
How important was your family support?
oh,
through all that?
100%. I couldn't have done
Yeah.
it. Absolutely could not have done it without them, and they were an integral part of it. So,
Of course. Did you know anybody that had breast cancer? Did you have any like friendly support, like girlfriends that
Nope.
could have helped you at the time or
I
gave you
knew
information?
0 people with breast cancer.
Wow.
I know them now, though.
Yeah. And is it like therapeutic for you now to help others?
Absolutely. Because everybody's different. Like somebody said, well, I didn't have a bad cancer. And I said, there's no such thing as a good cancer. Well, it was small and it was this, or it doesn't matter. You had cancer and you should, understand that. And don't say, well, mine wasn't as yours and I didn't lose my hair and I didn't have the problems you had. It doesn't matter. We're all in this together. We're all surviving and thriving. And that's what it takes. It takes a whole bunch of people.
Yeah. What is your best advice if someone came to you and said, I just got a diagnosis, what do I do?
I would sit down with your family, and then I would find an oncologist right away.
And then
Somebody you can trust and somebody who is knowledgeable.
Right.
Oncology is, there's surgeries and those really are life-saving. There's 3 doctors who saved my life, Dr. Nunnery, Dr. Wong, and Dr. Weber.
Right. Get to know your doctors too. I'm sure they
yeah.
get to know you.
Yeah, for sure.
And the nurses and all the other techs and everybody that's helpful.
Yeah. No, I mean, there's great care here. And if that at one point I thought I wasn't getting the care, I would have gone to any of those places because I'm lucky I have insurance. And I had means, I had family support. Some people don't have insurance and some people don't have support. And that's who I would like to try to reach. So I volunteer with the American Cancer Society.
Does the Cancer Society offer mammograms at all to someone who may not have insurance?
There is a way to go through it. I think it's through a different avenue than that, but there is money for people who can't. You just have to call like wherever they do mammograms and explain your situation, and then they'll find the funding that you need because it is important. It's a very good, quick detection, but it's not the end all be all. You really have to know your breasts, and you have to know how they've changed or lumpy or bumpy, or have it checked out if you're not sure, and keep having it checked out because sometimes people. Like inflammatory breast cancer, today is Inflammatory Breast Cancer Day, and that is a diagnosis that is on the superficial surface of your skin, not really inside of the duct. And it is once people have inflammatory breast cancer, that's considered a stage 3 or 4. And yes, there's lots of things to do to manage it. Everybody's doing, I have a friend with it and she's doing great. But people kind of blow off. No, that's not that. And you have a fever and you're sick. That's not breast cancer. But that's how different cancers present.
And there are
different
a
ways.
lot of different breast cancers, aren't there? Different types.
A lot of treatment options that weren't available when I was having treatment. That was just 11 years. So we've come a long way in 11 years. I think I'm really I'm optimistic for the future for the people who, unfortunately are going to have a diagnosis of breast cancer. But chemo is not fun and losing your hair is not bad. You don't have to have shampoo. You don't have to take extra time in the morning. It's very quick to get. If you go to the gym, you just put a hat on. It's like so easy. You don't have to worry about your hair, and that was freeing actually. That's one thing I could find that I didn't have to worry about.
Something positive.
Yeah.
Now, do you still have to go back and get mammograms?
No, I had
because
there's nothing there to mammogram, but
okay.
I did have an MRI once because of some kind of abnormality that we saw, but it was nothing. But the MRIs are more difficult, but again, everything is doable, 100%.
Is there something you'd like to say that I haven't asked about?
I'm living proof. If you want to do something and you care about whatever it is you're doing, you can do it. Just everything in my life has been that way. And if I can help one person, wow. And I know I have helped people along the way. And so I built up a big database of all local cancer survivors, and some were going through it at the same time I was, and some went after and some went before. And so it's nice to see other people and they know everything that you've been through because they've been through it too.
Well, you're an inspiration, obviously a strong woman, and we sure appreciate you sharing your story today. It's quite a story in that journey. I know it was hard, but we're so happy to see you today.
I'm glad to be here. Thank you for having me.
Deana Williams, thank you so much.
Thank you.
And that's it for 13 Now for this month. We invite you to tune in again on November 13th. We will be talking to the new breast cancer surgeon from Ascension Sacred Heart Bay. So we invite you to tune in for that. And ladies, don't forget to check for lumps and then go see your doctor. Thank you for watching. We'll see you next time.